Greetings and welcome to another episode of Caring for You with me, Dr. Terence Drew. Today we're going to deal with probably the most common cause of death in St. Kitts and Nevis and throughout the Caribbean, and that is heart disease. The heart, as we know, is situated inside the chest cavity between the two lungs, and its primary function is to pump blood around the body. And when that no longer happens, the body dies. So how does one get heart disease? What are the risk factors of heart disease? Some things we would have spoken about. 1, hypertension or high blood pressure. 2, diabetes or high blood sugar. 3, sedentarism or the lack of physical activity. 4, obesity. These are the most common, and so we can add also smoking, even though in St. Kitts there's not a high degree of tobacco smoking, but is a significant cause of heart disease. So these are the risk factors that we have to take care of to prevent heart disease. Now, what are the symptoms of heart disease? 1, weakness, tiredness, lethargy, or just feeling out of it, shortness of breath where you're breathing heavy and sometimes gasping for air. Something you can have such sweating and bad feeling. Some people can even have nausea and vomiting. Some people, when they walk up a step, they get tired very easily. Chest pain. And so, once you would have noticed these symptoms, it is prudent to visit your doctor. Now, how do you diagnose it? It is diagnosed first from the clinical history, or what those symptoms that I just spoke about. These would give the doctor clues as to what is really going on. Then the doctor would do a physical exam, and on the physical exam, he'll check your blood pressure to see if it's elevated or not. He'll check your blood sugar to see if it's high or not. Check your weight to see if you're overweight or if you're obese. And the obesity that is most dangerous is that which is centered around the midsection that we call visceral fat, that goes around all the organs inside the body and really affect their function in a very negative way. The doctor will ask questions about whether you exercise or not, and what is your diet. Is it consists of a lot of fruits, vegetables, water, or is it laden with saturated fat, such as a lot of fried foods and a lot of carbohydrates such as cakes and simple sugars? Those things are very important. Then the doctor will go on to do various tests, such as your blood sugar by a lab test, check your cholesterol, can also do heart tests such as an EKG, which is often done. Having done all of these tests, they can become very more complex, such as a stress test. That's where you go on a treadmill and you have all these wires on you and you do the exercise, so we can see what is happening when the heart is working. Is enough blood going to the heart? Is the heart able to pump enough blood around the body? We can send you for an ultrasound of the heart, which we call an echocardiogram, to look at the structure of the heart and see if the heart is functioning in a normal way or not. And you can even go on to do angiograms. That is where a guide wire is introduced at the wrist level, at the groin level, and introduced all the way up into the heart to really see if there are blockages in the arteries of the heart. There are others you can do, such as CT scans, MRIs, which can help the doctor determine the degree of heart disease. Now, once all these tests are done and the doctor is satisfied that you have some level of heart disease, what is done? So treatment. Treatment can be surgical. Some people might need bypass surgery, where you cut the chest open and redirect blood vessels around the heart to increase oxygen and blood flow. Some people might just need a stent, where you pass the wire and leave a stent to open up the coronary. Some people might just need medication, such as statin, aspirin, medications such as beta blockers, such as atenolol, blood pressure medications such as Zestrel, or you can also take losartan. There are many different classes of blood pressure medication. Some people might need what we call nitroglycerin to really help to open up some of the blood vessels. But the medication, along with surgical intervention, can really help to revive the heart. But the fundamental treatment is non-pharmacological. That is to get up, exercise, change your diet, eat healthy, make sure you're not under significant stress. These things can help to prevent your heart from failing or to help to reverse some of the effects of coronary heart disease, at least stop the progress of it. So as I wrap up, the message I want to leave with you is for a healthy heart, exercise, get to a normal weight, eat lots of fruits and vegetables and water, quit smoking, get enough sleep, avoid stress, and most of all, enjoy a happy life. That too helps the heart. Thank you for joining me for another episode of Caring for You with me, Dr. Terence.